Assalamu alaikum students. This is lecture of the grass anatomy for first professional MBBS students. The topic is anatomy of the hand. I am Dr. Kalimullah, demonstrator anatomy department, GKMC Swabi. In this discussion, our objectives will be to discuss the facial structures of the hand, the palmar aponeurosis, the fibrous flexor sheath, the extensor expansion or the dorsal digital expansion, and the palmar spaces, and lastly the intrinsic muscles of the hand. The palmar aponeurosis. It is the deep fascia of the palmar aspect of the hand. It is thickened centrally, four distinct extensions it sends to the bases of the fingers, and it discontinues with the fibrous tendinous sheaths. The subdivisions of the palmar aponeurosis. Palmar aponeurosis is superficially attached to the skin by means of the retinicular cutis, and deeply it sends septa or bands. They diverge around the flexor tendons and fuse with the fibrous flexor sheaths and the deep transverse ligaments. The palmar aponeurosis invests the palm muscles are the intrinsic muscles of the hand. The lateral and medial portions of the palmar aponeurosis. It continues with the thin fascia covering the thinner and the hypotenure muscles, the thinner muscles on the lateral and the hypotenure on the medial aspect. Medially, palmaris brevis, a small rectangular muscle which arises from the palmar aponeurosis and the flexor retiniculum, and it inserts on the same side in the skin and supplied by the superficial branch of the ulnar nerve. Bilaterally, septa pass and dips upon the metacarpal bones and divide the palm into palmar spaces. The functions of the palmar aponeurosis. It is firmly attached to the skin, form ridges in palm, helps to grasp objects firmly, protects the underlying structures, that is the blood vessels and the nerves, and provides attachment to muscles. The fibrous flexor sheath. It begins anterior to the metacarpophalangeal joints and extends to distal phalanges, gives passage to the flexor digitorum profundus and the flexor digitorum superficialis tendons. Fibrous flexor sheath is formed by the fibrous arches and the cruciate or cross ligament attached posteriorly to the margins of the phalanges. They hold tendon to the bone and prevent tendons from bowing while flexion of the digits. The tendons in the tunnel are surrounded by the synovial sheath. The synovial sheaths of the thumb and the little finger are continuous with the that in the carpal tunnel. The synovial sheath of the thumb is also called the radial bursa, and that of the little finger is called the ulnar bursa. The extensor hood or the extensor expansion or the dorsal digital expansion, in which the extensor tendons they merge. The extensor digitorum and the extensor Pollicis longus tendon expands over the proximal phalanges to form extensor hoods or the dorsal digital expansions. The tendons of extensor digiti minimi and extensor indicis and that of the extensor pollicis brevis, they join these hoods. It is a triangular structure of the dorsal digital expansion, and its apex is attached to the distal phalanx its center to the middle phalanx. Its base is attached or surrounds the sides of the metacarpophalangeal joint. The corners attached to deep transverse metacarpal ligament. Some other attachments to the extensor hood: the lumbricals, intrashi, abductor digiti minimi, abductor pollicis brevis, and the abductor pollicis. Inserting into the extensor hood, the intrinsic muscles are able to bring about delicate, fine movements of the digits, the fulcrum-like movements of the at the metacarpophalangeal and that at the interphalangeal joint. So at the metacarpophalangeal, the main action is flexion, and at the interphalangeal joint, the main action is the extension. By this means, fine delicate movements can be brought about, and these are the example is an upstroke when someone is writing. The palmar spaces. Fibrous septa dips in the palm from palmar aponeurosis bilaterally and divides the palm into hypotenure and tenor spaces. In the mid palm, there is another space that is called the mid palmar space. Other spaces of the palm are uh, the whip space, the pulse space, and the space of perona. These spaces are the empty regions in which some structures they are lying and they are separated from the other structures. The hypotenuse space, in this case, the palmar aponeurosis, it dips deep in the palm and attached to the fifth metacarpal bone to form the hypotenuse space. The mid-palmar space, deep to common synovial sheath. Its floor is formed by interosseous muscle and third and fourth metacarpal bone. On its sides, septa dips from the borders of the palmar aponeurosis. The contents of the mid-palmar space are flexor digital sheaths of digits number 3rd, 4th, and 5th, lumbricals, and the digital nerves of the 3, 4, and 5 digits. The clinical importance: the infection easily spread in this space. Proximally, it is limited by synovial sheath. The concavity of the palm is obliterated whenever there is infection in the mid-palmar space. The thinner space, septa from palmar aponeurosis dips and attached on border of third metacarpal bone. Its contents are the first lumbrical flexor digital sheath for the first and second, and digital nerves for the first and second digit, open with a slit distally and closed above in the wrist. The lumbrical canal. It is a potential space surrounding tendon of each lumbrical and is normally filled with connective tissue. Proximally, it is continuous with one of the palmar spaces. The whip spaces. There are three whip spaces in the distal palm between the proximal phalanges of four fingers. They extend up to metacarpophalangeal joints and they are filled with loose fibrofatty tissue. The whip space can be infected and the infection is localized and makes great discomforts if not drained, as it is shown in the diagram on the right side of the slide. The pulse space on palmar aspect, tips of the fingers and thumbs contains fat. The fibrous septa divide it into compartments. The septa dips from skin to the distal phalanges, and this is shown in the diagram given below. The blood supply of the pulse space. The pulse space receives its blood supply from the terminal branch of the digital arteries. The epiphysis of the bone is supplied by the proximal branch. In the infection may occlude vessels, causing necrosis of the bone. Proximally, space adheres to the skin and prevents the spread of infection. The whitlow is a condition in which there is infection of the pulp. If neglected, whitlow may lead to necrosis of the distal fifth of the terminal phalanx. The proximal one-fifth is spared and not necrosed, as its artery does not traverse the fibrous septa and is not occluded. The dorsal spaces. There are two types of dorsal spaces. The dorsal subcutaneous space is semi-subcutaneous. It is located deep to loose skin of the dorsum of the hand. In the subcutaneous space infection, pus is pointing through the skin and can be drained through the maximum pointing site. The dorsal subtendinous space, the location is between the metacarpal bone and the extensor tendons where they unite to one another by a thin aponeurosis. The infection, in case of an infection of the subtendinous space, the pus points either at the web or at the borders of the hand and can be drained accordingly. The space of perona or the space of the forearm. It is a rectangular space. It is located in the forearm, deep just above the wrist, in front of pronator quadratus and deep to long flexor tendons. It extends up to the origin of flexor digitorum superficialis. Superiorly and inferiorly, it extends up to the flexor retiniculum and communicates with the mid-palmar space. The clinical aspect is it may be infected through infection in the related synovial sheaths. The muscles of the hand are the intrinsic muscles of the hand. There are four groups of the intrinsic muscles of the hand. These are tenors, hypotenors, lumbricals, and the interossei. The tenor muscles, their arrangement is shown in the diagram on the right side. The abductor pollicis brevis, the flexor pollicis brevis, the adductor pollicis, and the opponens pollicis. The abductor pollicis brevis, its origin is from the flexor retiniculum, the scaphoid, and the trapezium bone. Its insertion is at the base of the proximal phalanx on the lateral aspect of the dorsal digital expansion. Its nerve supply is from the recurrent branch of the median nerve as shown in the diagram, and its action is it brings about abduction of the thumb at right angle to the palm. The flexor pollicis brevis originates from the flexor retiniculum. Its insertion is at the base of the proximal phalanx with abductor pollicis brevis. It is medial to the abductor pollicis brevis, lying alongside the abductor pollicis brevis. It receives its nerve supply from two nerves, the recurrent branch of the median nerve and deep branch of the ulnar nerve. Its action, it flexes the carpometacarpal and the metacarpophalangeal joint of the thumb. The opponent's pollicis, it lies underneath the abductor pollicis brevis and the flexor pollicis. It arises from the flexor retiniculum, inserts on the entire thumb metacarpal bone on the medial aspect, and its nerve supply is from the recurrent branch of the median nerve. Its action, it flexes the metacarpal bone Medially rotate the thumb, bend the thumb across the palm, and pinch the thumb with the index finger. The adductor pollicis arises by two heads. The oblique, it arises from the base of the second and third metacarpal bone. The transverse head arises from the distal two-thirds of the third metacarpal bone. It inserts at the base of the proximal phalanx and extensor hood of the thumb on the medial aspect. It receives its nerve supply from the deep branch of the ulnar nerve. It is the only muscle in the thinner muscles, out of the thinner muscles, which is supplied by the branch of the ulnar nerve. Its action: it adducts the thumb and flexes the metacarpophalangeal joint and approximates the thumb to the palm. The hypotenure muscles. These are the palmaris brevis, abductor digiti minimi, flexor digiti minimi brevis, and opponens digiti minimi. Palmaris brevis muscle. It is a thin quadrilateral muscle beneath the skin on the ulnar side, arises from flexor retinaculum and the palmar aponeurosis. It inserts in the skin on the ulnar border. The nerve supply is from the superficial branch of the ulnar nerve. Its action is it deepens the hollow of the palm. It wrinkles the skin on the ulnar side and helps in gripping. The abductor digiti minimi arises from the pisiform tendon of the flexor carpi ulnaris and inserts upon by two slips at the base of the proximal phalanx and the dorsal digital expansion of the extensor digiti minimi. Its nerve supply is from the deep branch of the ulnar nerve and its action is it abducts the proximal phalanx of the little finger. The flexor digiti minimi brevis muscle arises from the flexor retinaculum and the hook of the hamate bone. It inserts at the base of the proximal phalanx and its nerve supply is the same as that of the abductor digiti minimi. Its action is it flexes proximal phalanx. The opponens digiti minimi, it lies under the flexors and the abductor muscles. It arises from the hook of the hamate and the flexor retinaculum. It inserts along the whole of the fifth metacarpal bone, supplied by the deep branch of the ulnar nerve. It draws the fifth metacarpal bone forward and it rotates it laterally so as to deepen the hollow of the palm. The opponens digiti minimi and the opponens pollicis, they approximate to each other by means of the opponens digiti minimi muscle and the opponens pollicis muscle. The lumbricals and the interossei muscles in the middle of the palm and the metacarpal bones. The lumbricals, they arise from the tendon of the flexor of the digitorum profundus muscle, as you can see in the diagram on the right side. The first and second are unipinnate. You can see the first and second on the right side of the diagram. These are the unipinnate lumbrical muscles and they arise from the tendon of the index and the middle finger respectively. The third and the fourth are bipinnate and the third arise from the adjacent side of the middle and the ring fingers. The fourth from the ring and the little fingers. The insertion of lumbricals. Each insert and extensor expansion on the radial side or the lateral side. The first and second is supplied by the median nerve and the third and fourth is from the deep branch of the ulnar nerve. Their action. They flex the digits at the MCP joint and association with the interossei, extend IP joints, interphalangeal joints. The hand makes an L shape and they are highly active during extension of the IP joint. These muscles are used during writing. The interossei, they occupy the interval between the metacarpal bones. They are arranged into two groups, the palmar and the dorsal. The palmar are small and they are arising from their own metacarpal bone. The dorsal are larger and they are arising from the adjacent metacarpal bones space in which they lie. The middle finger, we take the midline or the standard, and along this middle finger, their actions are considered. So the palmar are adductors, PAD, and the dorsal are abductors, DAB is the formula used for these two groups. The dorsal interossei. These are four bipinnate powerful muscles, powerful than the palmar interossei. They arise each by two tendons from adjacent sides of the metacarpal bones. Their insertion is on the basis of proximal phalanges and the dorsal digital expansion. Now the insertion of the dorsal interossei continued from slide number 28. The first interosseous is abductor indicis, inserts on the radial aspect of the proximal phalanx of index finger. The second is on the radial and the third on the ulnar side of the middle finger. That is why the middle finger does not move radial on the radial side or on the other side. So it is taken as the standard and regarding the movement of the fingers. Fourth dorsal interosseous attach on the ulnar side of the proximal phalanx of the ring finger and the dorsal digital expansion. Their action is abduction. They abduct their own finger away from the midline. The minimi digits, the small finger, it does not receives any abductor over here because it has its own abductor, the abductor digiti minimi in the hypotenure muscles. Now the palmar interossei, these are four in number. They are unipinnate. The first interosseous, the adductor pollicis is considered to be the first interosseous. It arises from the ulnar surface, ulnar side of the palmar surface of the first metacarpal bone, inserts on the ulnar side of the proximal phalanx. The second interosseous, it arises from the ulnar side of the second metacarpal and inserts on the same side of the digital expansion of the index finger. The third interosseous arises on the lateral side, on the radial side of the fourth metacarpal and inserts on the radial side of the base of the proximal phalanx of the ring finger. The fourth arises from the radial side of the fifth metacarpal and inserts on the radial side on the same side of the proximal phalanx of the little finger, and their action is the adduction of the fingers toward the middle finger. So PAD, palmars are adductors. This is the formula for the action of the palmar group. Now the nerve supply. The nerve supply of all the interossei, whether they are palmar or the dorsal interossei, is from the deep branch of the ulnar nerve. Okay, this was all about the facial structures and the intrinsic muscles of the hand. I hope you would have followed me. Thank you very much, students. Allah may bless you all. Thank you.